Understand.
Your admission letter from the hospital will tell you the date and time of your operation and what time you need to arrive. It should also tell you which ward or department you're going to be in, a contact number for your hospital or ward, and a consultant who will be taking care of you. When you arrive, a member of the staff will explain the process to you and give you an identity bracelet to wear during your stay in the hospital. During your time in the hospital, you may be asked the same questions by several people. This is a routine and ensures that correct information about you is checked and available at each stage of the treatment. You may want to ask some questions of your own, so write them down in advance so you won't forget anything. Take any medications your doctor asks you to take before surgery. However, if you normally take tablets or insulin for diabetes, make sure you mention that to your surgical team. You'll be asked whether you're allergic to any medications, if you throw up after surgeries, or whether any relatives have ever had any problems with an anesthetic. You will be asked to change into a hospital gown, and the details of the operation will be explained to you. You'll then be asked to sign a consent form, giving your permission for surgery to go ahead. This form indicates that you know what the surgery is for and that you understand the risks, benefits, and alternative treatments. For some operations, a needle connected to a drip will be injected into your hand, allowing fluids, nourishment, and medicine to be given while you're under anesthetic. You'll be given an anesthetic, so you won't feel any pain during the operation. A general anesthetic will be needed for a major operation, which means you'll be asleep throughout the whole operation. It will be given to you via an injection or gas, which you breathe through a mask. If you don't need to be put to sleep, you'll be given a regional anesthesia. This means you'll be conscious throughout the operation, but you won't feel any pain. It may be a local anesthetic, where a small area is numbed, or an epidural, which will make you lose the sensation in the upper or the lower part of the body. After surgery, you will be moved to the recovery room, where you'll be told how the operation went. You may feel dizzy as you come round from the anesthesia. A nurse will give you oxygen through tubes or a mask to help you feel better. It's common to feel sick or vomit after you've been given anesthesia. You may also have a sore throat or dry mouth. Your blood pressure will be taken via an automatic cuff that squeezes tightly at regular times, so don't be afraid of it. Your temperature will also be taken. It's important to find out how well your operation went. So here are some questions you may want to ask your doctor. Tell your nurse as soon as you start to feel any pain so that they can give you pain-killing medication as soon as possible to stop it from getting worse, because the medication can take 20 minutes to start working. The sooner you start to move around, the better. Lying in bed for too long can cause some of your blood to pool into your legs, and this puts you at risk of a blood clot. If possible, doing some leg exercises to help you prevent a blood clot, it would be great. You may be also given special support stockings to wear after surgery, or an injection to thin the blood slightly to help reduce the risk of clots. Research shows that the earlier you get out of bed and start walking, eating, and drinking after your operation, the faster the recovery will be. Before you leave the hospital, you'll be given advice about how to care for your wounds and how often to use the medications. And feel free to ask your doctor some questions before you leave the hospital. Here are some examples. You might be feeling very tired when you go home, especially when you've had a major operation or a general anesthetic. If you or your caregivers at home notice any of the following signs after your surgery, call the doctor immediately. Pain or swelling in your leg. The pain may be made worse by bending your foot upwards towards your knee. The skin of your leg feeling hot or discolored. the veins near the surface of your leg appearing larger than normal. Those could be signs of deep venous thrombosis, DVT. If DVT is not treated, a pulmonary embolism may occur. Pulmonary embolism is a blood clot that has come away from its original site and becomes lodged in one of your lungs. If you have a pulmonary embolism, you may experience more serious symptoms such as breathlessness, which may come gradually or suddenly, chest pain, which may be becoming worse when you breathe in, or you might even collapse suddenly. Your doctor will have given you an idea of how long it will take to get back to normal. As a rough guide, it will take you about a week to recover from a simple operation, such as gallbladder removal, and a few months to recover from a major operation, such as a hip replacement. Wishing you a speedy recovery. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.